Hello, welcome. I'm Dr. Tony Malioco, the Cancer Informant. Today's episode will be focused on cancer prevention, risk, and screening. Cancer is a disease that's actually increasing in incidence and prevalence. This is mostly due to the aging of the population. Currently, cancer is the second commonest cause of death. If current trends persist, cancer is poised to become the most common cause of death in Western society, surpassing deaths from cardiovascular disease. The reason for this is that advances in cardiovascular disease treatments are reducing the incidence of death from conditions such as heart attacks and stroke. Cancer advances are being made, but because of the aging population, the prevalence of cancer is still dramatically increasing, particularly in places like North America. Now, first of all, let's consider what are the major risk factors for the development of cancer. First and foremost is age. Cancer is a disease of aging. Cancer is most commonly due to defects that occur in proliferating cells. So as cells in the human body divide, they are prone to developing errors. These errors may be inconsequential. However, in some cases, the errors may lead to increased proliferation and eventually development of cancer. Some individuals appear to be more prone to the development of cancer than others, and this is most often due to inherited genetic conditions. Interestingly, the genes that are involved in inherited conditions are most commonly related to DNA editing and repair. So, for example, one common type of inherited cancer syndrome is breast ovarian cancer syndrome. In this condition, patients who inherit a defect in a gene called BRCA1 or BRCA2 are prone to increased risk of developing breast and ovarian cancer. In addition, in men, they may be at greater risk of developing prostate, pancreatic, and other cancers as well. Science and investigations have shown that the BRCA1 genes are involved in DNA repair. In a pathway called homologous DNA repair, these particular genes make enzymes that detect damage and assist in the repair. Consequently, in individuals that have defective genes, they're more likely to accumulate damage, which can lead to the development of cancer. There are many different kinds of inherited cancer conditions. For example, FAP, polyposis of the colon, neurofibromatosis, Lynch syndrome, and many others. How might you know if you belong to a family with cancer syndrome? Well, one of the things is knowing about your family history. So if you have a good record about your parents, your aunts and uncles and grandparents, you might get a clue. If there are many of your family members have developed cancer, this is an indication that you might belong to such a family. Other clues are multiple cancers occurring in the same person. For example, you might have an aunt that has developed breast cancer and ovarian cancer. The development of two cancers in an individual is a strong indicator that they might carry a predisposing gene. In addition, another strong indicator is that one of your relatives have developed cancer at a young age. And by young age, I mean younger than age 50. So developing cancer at a young age is certainly a strong indicator of an inherited cancer syndrome. With the recent advances in genetics, it's actually quite easy to now test individuals for their genome and for presence of inherited genes. This test can be very helpful in determining if a particular individual is at high risk of developing a cancer. If you are found to be at high risk, there are actual disease modification strategies that you can reduce risk, and we can talk about that later. The next thing that is related to the development of cancer is exposures. As a person ages, they're exposed to many different environmental toxicities. These can increase the probability of getting cancer. Some of the most important environmental toxicities are things such as smoking. Smoking exposes a person to carcinogens, not only in the mouth and airways. Tobacco smoke might also be absorbed into the blood and into the intestines and damage many organs. Tobacco smoke causes damage to the cardiovascular system and can also increase the risk of pancreatic cancer, bladder cancer, rectal cancer, and many other types of cancers as well. So in general, cessation of smoking is a very powerful strategy to reduce cancer risk. Also, it's known that individuals who continue to smoke while on treatment for cancer may actually have worse outcome as well. Continuing to smoke may affect the way that the body responds to cancer therapy and may reduce the efficacy or the efficiency of cancer therapeutics. Therefore, it's always a good idea to try to quit smoking as soon as possible. Other exposures that are related to cancer risk include toxins such as alcohol. Evidence is beginning to grow that alcohol is a factor that can be associated with many different kinds of cancer, everything from breast cancer, colon cancer, and other types of cancer. So certainly reducing the amount of alcohol intake is a solid strategy for decreasing cancer risk. There are many other toxins in the environment, for example, secondhand smoke, environmental pollutants, chemicals, radiation, and so on. So many of these are harder to avoid. In an occupational setting, it is important that if you are in an industry that does expose you to chemicals, for example, petrochemicals, solvents, dyes, and other types of chemicals, appropriate protective gear be utilized to reduce risk. Some individuals also find themselves working in environments where there may be radiation exposure and other types of risks that can increase the development of cancer. Always use appropriate safety equipment and follow safety guidelines. Interestingly, some occupations, such as firefighters, have extreme risks of developing cancer over their lifetime, and the development of occupational cancer is one of the commonest causes of death in some of these individuals. More recently, it's been determined that certain types of pesticides, such as Roundup 2,4-D and others, may be associated with the development of leukemia and other cancer syndromes. Also, some products that may have been used in the past, such as talc powder and other similar products, may have exposed people to things such as asbestos and other fibers that can increase cancer risk as well. So there are many environmental factors that can certainly be associated with cancer risk. Epidemiological studies sometimes uncover cancer clusters where we see certainly hotspots where many new cancers are developing within a short period of time. These are certainly causes for concern and often lead to investigations by health authorities to determine what the cause of those particular cancers are. Now, moving beyond chemicals and genetics, there are other agents that can cause cancer as well, such as infectious agents. A lot of work has shown now that some viruses can be very powerful carcinogens, and one of the most notable is human papillomavirus. It was determined that human papillomavirus is one of the major causes of cervical cancer, and that by using vaccination for human papillomavirus, that the incidence of cervical cancer can be dramatically reduced. Now, it's also been determined that human papillomavirus may also be responsible for other types of cancer, such as anal cancer and head and neck cancer in the mouth and tonsils. This can occur in both men and women. And so it's now recommended that both genders have vaccinations with human papillomavirus vaccine at school age. Other viruses that have been associated with cancer include hepatitis B. Hepatitis B can cause chronic liver disease, which can progress to develop into liver cancer. Other viruses include Helicobacter of the stomach. So chronic gastritis can lead to cancer of the stomach, most often lymphoma, and other conditions, even conditions such as tuberculosis, chronic inflammation, and others can lead to various cancers such as lung cancer, bladder cancer, and other types of cancers. This has uncovered the idea that inflammation can be a powerful driver of cancer. And really, studies are starting to investigate this. How does chronic inflammation actually drive cancer? Now, we can see that the immune system is an important regulator of cancer. And we know that patients who have a defective immune system, for example, patients who may have HIV or AIDS, are at much higher risk of developing certain kinds of cancer. We know that individuals with HIV and AIDS may have an increased risk of lymphoma and also certain types of cancer such as Kaposi's sarcoma. A functional immune system is really quite important for keeping cancer in check. Now, also patients who are under immune suppression, for example, if they have received an organ transplant, a kidney transplant or other organ, when they're undergoing immune suppression, their risk of cancer may also be increased. Immune suppression, again, is an important risk factor for subsequent development of cancer. Some other comorbidities that can be associated with cancer, an important one is diabetes. We're not quite sure as to why does diabetes cause increased risks of cancer. There's some speculation, could diabetes be causing cancer through altered sugar metabolism? We know that cancer cells adjust their ability to metabolize sugar and actually shift into a mode of metabolism where they actually crave sugar. So the cancer cells tend to preferentially burn sugar. This is the so-called Warburg effect. Now, we don't know if in diabetes that the increased amounts of sugar might help cancer cells proliferate and potentiate. So this is one theory. Other theories are that patients with diabetes might also have increased growth factors, such as insulin-derived growth factors that might be in their blood that can also drive cancer cells, or that increased sugar or other alterations in diabetes might suppress the immune system, which can also lead to the development of cancer. So a lot of work is being done regarding diabetes and metabolic syndrome. In fact, we find in countries like the United States that diabetes and something called metabolic syndrome is an important precursor to many types of diseases, including cardiovascular risk, cancer, and others. There's a lot of effort in the public health system to try to reduce the amount of diabetes in society and to detect diabetes at an earlier age where it can be corrected. We're certainly learning more about that. Now, another area where there's some study underway is the investigation of the microbiome. Now, it appears that the microbiome may somehow have very intricate interactions with the immune system, and particularly the microbiome of the gut. So if the microbiome of the gut becomes disorganized or becomes altered, it may lead to alterations in the immune system and actually may lead to cancer risk increasing. Also, microbiome adjustments or alterations can impact how cancer therapies work, particularly immune therapy. The study of the cancer microbiome is a very hot area of investigation, and scientists are uncovering a lot more information about how the cancer microbiome works. Interestingly, there's been some work in the last few years that have shown that cancer cells may actually frequently be infected with bacteria or fungi, which is quite a curious discovery. And has led to the idea that, wow, maybe these microbes could somehow drive cancer cells, and possibly there might be strategies to combat cancer that could focus on trying to attack the microbes that might actually play a role in the propagation of cancer cells. So stay tuned to learn more about what's happening in the microbiome and immune systems. Now, one of the best strategies to combat cancer is early detection. We know that the development of cancer takes over a long period of time. It may take years for a normal cell to turn into a cancer cell. Over this period of evolution, there's a window of opportunity. This window of opportunity allows us to detect cancer at an earlier and more curable stage. So the reason that cancer kills is because it spreads. Initially, cancer starts as a localized disease, usually localized as a lump in a single organ. So when a cancer is in this condition before it is spread, it can be fairly easy to treat. It can be surgically removed and really completely removed from the patient, with dramatically reducing the risk of recurrence. One of the key strategies is, first of all, prevention, but if a cancer is present, to detect it as in early a stage as possible. One of the most effective screening strategies was the development of the Pap smear. Cervical cancer was one of the biggest killers of women in the last century. The development of the Pap smear, where basically cells from the cervix would be examined under the microscope with a special stain, could detect cervical cancer at its earliest stages, and then interventions could be arranged. These interventions include surgical removal of the cervix or ablation of the abnormal cells on the cervix, which stop the development of a progressive cancer. And these screening strategies were extremely effective and turned cervical cancer from one of the most common killers of women to a very unusual event today, particularly in women that undergo regular Pap smear screening. New strategies are even improving the effectiveness of Pap smear screening by including human papillomavirus detection along with the Pap smear to really increase the sensitivity of detecting early cancer cells in the cervix and enabling removal of those very small lesions before they can progress. In other organs, screening strategies have also been developed. For example, colon cancer. So screening strategies include the screening for fecal occult blood and also colonoscopy. So the performance of colonoscopy in persons who have fecal occult blood or at a regular interval can detect colon cancer at a very early stage. In fact, at the non-invasive stage where it really exists as a polyp. So removing the non-invasive polyps can interfere with the development of a colon cancer and actually lead to total interruption of the onset of cancer. In addition, colonoscopy can detect if the cancer has gone on to invade early colon cancer before it is spread to other organs. So as I said, detecting cancer at an early stage, like stage 0 and stage 1, are very, very curable stages that can be cured basically by local surgery and local treatments. If a cancer has gone beyond the local stage and spread to other organs, it's currently considered generally incurable and requires much more costly and morbid-inducing systemic therapies. So getting cancer at a very early stage is obviously the best way to go. Other screening modalities are mammography. Mammography can detect breast cancer at a very early stage. Basically, using X-rays, the breasts are examined and abnormal lesions can be identified. Often they're characterized by areas of microcalcifications or densities. When these are observed, surgical biopsies are done, and a pathologist can determine if cancer is present or not. The mammographic screening programs are aimed at detecting cancer when they are, again, small, curable, and before they're spread. Breasts present a particular problem in that ladies with denser breasts frequently are more difficult to screen with normal mammography. Newer techniques are being developed that include tomography, 3D digital mammography, MRIs, and other types of approaches, because mammography does suffer from problems with sensitivity and specificity. Interestingly, in the last few years, there are more technologies that are now being detected using something called liquid biopsy. Liquid biopsy is really just a fancy name for blood tests, and many technologies are now under investigation and are into utilization. Some of the earliest blood tests for cancer included things like PSA, prostate-specific antigen, that could detect prostate cancer at an earlier stage, and also something called CA-125. CA-125 was a marker that could detect ovarian cancer at a particularly early stage as well. Now, the problems with PSA and CA-125 were they were not particularly specific, meaning that they were often elevated in people who didn't have cancer, which led to concerns and possibly unneeded surgeries and biopsies and so on. These two markers fell out of regular use as cancer screening. Newer technologies are now on the market that appear to have higher sensitivity and specificity, although many of them are still under investigation in clinical studies. Examples are things such as the Grail-Gallery test, which looks at methylation alterations in blood to detect cancer at an earlier stage. And there are many other companies that have developed DNA tests looking at circulating DNA in blood to detect early cancers. Now, methylation is a change that occurs in cancer cells often before they become invasive. So being able to detect these at an early stage can offer the opportunity to do the earlier interventions. Some investigations have shown that looking at the methylation pattern may also uncover where the primary cancer might be, for example, localizing it to the prostate gland, pancreas, colon, etc. Now, there are also cancer screening tests that can be done on urine, looking for the presence of bladder or kidney cancer. And there are even newer tests that are being used on breath samples. It's intriguing to know that our friends, the canines, have been shown to be able to be trained to identify cancers in patients by odor. So dogs can be trained to identify ovarian cancer and other types of cancer at early stages through alterations in odor from a patient. It's unclear exactly how this works, but fragments of cancer cells may be emitted in breath. There may be organic volatiles that are emitted in breath and so on. So it's an important area of investigation. We're also looking at other strategies beyond using dogs to detect cancer fragments in breath samples. That's the conclusion of today's talk. In summary, the development of cancer, there are many key risk factors. These include age. As you get older, your risk of cancer goes up. Hereditary factors, if you belong to a family that has strong amounts of cancer in the family or many members with developing cancer, particularly at a young age, you may be at risk and should consider genetic screening and testing so that a screening strategy might be developed for you. We learned that there are many environmental toxins that can drive cancer. These include smoking, viruses, and other types of toxicities that can drive cancer. And again, many of these could be avoided. And we are developing vaccines that can counteract some of these. We learned that the immune system is an important component to suppressing cancer, and that patients who have suppressed immune systems, either through disease or through therapeutics, may also be at increased risk of cancer and perhaps should increase their screening strategies. We also talked about many different screening strategies that can detect cancer at an earlier stage. Again, there are many ways to reduce one's risk of cancer and to improve one's risk if you actually have cancer by detecting it at an earlier stage. I hope you enjoyed today's episode and found it to be informative and educational. I encourage you to visit our website for the Cancer Informant. There are opportunities to leave questions, which we can answer in future podcasts or directly. And also you can listen to other episodes of the Cancer Informant. So thank you again for listening to today's show. I'm Dr. Tony Maliocco, the Cancer Informant. Have a wonderful day. Goodbye.